Hi, everyone. Welcome to our Facebook Live presentation today. Thanks so much for your patience and sticking with us. My name is Laura Sago. I am one of the co-founders of Curable and the host of our podcast, Like Mind, Like Body. And today I am thrilled, as are many of you, to welcome Evelyn Hecht to Curable's Scientific Advisory Board and here to our office. Evelyn joins us with 22 years of experience in physical therapy, specifically addressing pelvic floor dysfunction and related conditions. So she is actually an NYU master clinician of pelvic physical therapy. She designed the very first APTA accredited course for pelvic floor dysfunction. And she's been teaching that course at NYU for over 7 years to the future physical therapists of the world. So welcome, Evelyn. Thank you so much for joining us today.
My pleasure. I am so happy to be here and share information and welcome all the Curable users.
Yes, I know they're very excited to meet you and very excited to ask their questions. So the way we're going to structure this, I'm going to start out by going over a few basics with Evelyn of actually what she does and what this specialty is all about. Then we're going to answer some of the pre-submitted questions from the online Curable Facebook community. And then finally, my team will be feeding me some of your questions that you are typing into the comments during this Facebook Live. So I want to go ahead and start with something really general. You've been doing this for 22 years. And when you first started specializing in the pelvic area, this wasn't very common or even really all that accepted. So what made you decide to specialize in this region in the first place? And how have you seen the space evolve over time?
Right. Well, I kept getting so many people under hushed tones asking me about their private issues while I was working with their lower back or hip or really any part of their body. And I kept getting so many patients asking me, I'm not able to have intercourse with my husband. How am I ever going to have a baby? Or I'm peeing all the time. I don't know what to do about it. I'm starting not to be able to go out with my friends. I feel so embarrassed. I'm not sure what to do. Do you know anything about this? And so I asked some of my colleagues at that time when I was just starting out as a physical therapist, and they looked at me. I asked them, are you getting these questions as well? Because they seem to be so prevalent for me. And they all looked at me like, no, I've never had these questions. So I sensed that it was one of my callings was to open my practice and open my understanding of how the pelvic floor works within our whole body. Mm-hmm. And at that time, there was really nobody doing pelvic floor work. Actually, it wasn't even a field outside of one course being given in my professional American Physical Therapy Association. So I attended that course and started implementing some of the ideas and just going with what does a patient present with, what are their stories, and learning from them and implementing some treatment techniques, a wide variety of treatment techniques. And to my amazement, they started to have improved function, able to tolerate sex with their partners, able to go to the bathroom more easily. And it was a challenge in certain respects because this was unknown in New York at that time. So there was a lot of questions I would be getting from my colleagues and other professionals. What are you doing in the pelvic floor? A little bit like taboo. Should you be working in that area? But I just kept seeing so many people improve that I said, well, I'm going to do it anyway. So that's the deal.
And we're so glad you did.
Yeah, me too. Yeah.
Yeah. So a lot of people, when they think about physical therapy, they imagine that it's something you go to once or twice a week and you have to continue on for the rest of your life. And the point is to become dependent on this physical therapy and this manual manipulation. But that's not really what you do in your practice at all. So what are your goals? Let's clear that up. What are your goals when you're working with a patient?
Right. So the first thing that my goal is to develop a therapeutic alliance with a patient. So I am going to ask them, please tell me your story. And I'm going to look at them with eye contact. I'm not going to write down tons of notes because I'm going to make sure I remember. And I'm going to give them a full breath of time that they need to tell me their story. I find that uninterrupted conversations by the patient to me really allows them the doors to open and they can free flow however they want to go. And then once I listen and understand what their situation is, I'll suggest ask them, what are your goals? What would you like to attain? What kind of movements do you want to do? What kind of functions do you want to see that's getting better and better? So we come up with goals. And we also come up with, well, here are some of my intervention techniques that I'm going to utilize. I'll explain them to you and see if that's something that resonates. And if we agree, then I will be a guide to help you learn how to recruit your own healing skills, your own healing ability to get better. So can I go into one or two of those things that I may do?
Absolutely.
All right. So the first thing is I'm going to incorporate some manual therapy. Now, manual therapy in the traditional sense of a biomedical sense is I'm going to physically lengthen muscles and I'm going to really manipulate joints to put them all in the right space. Everything's going to be 100% balanced, and that's the reason why you're going to get better. But that's not the case. In the recent pain neuroscience, it's all about helping to lower the nociceptors, helping to lower the sensitivity of the nervous system, helping the brain to send more pain inhibiting chemicals, the opioids, the oxytocin, helping to lessen the pain or lessen the fear of being touched in that area of pain. And so manual therapy is not going to be aligning and manipulating. It's going to be decreasing the nervous system sensitivity and the brain sensitivity.
Mm-hmm. Absolutely.
So that's just one thing, and there's more, but you can continue.
Go on.
Yeah. So the other thing that that I incorporate is I'm going to help you figure out what exercises would be good for you, and again, based upon the new science of pain that we know now in the last number of years, 7 or 10 years. And I'm going to help you figure out what are the exercises that make you feel safe. And we'll do something small and start really easy and listen to what your body says. And we'll give you some guidance along the way to see if exercise is something that you feel it's dangerous, you feel it's safe, and how can I guide you on that path.
Mm-hmm. And I love that. I mean, it's all about the movement, right? The body loves movement. The body wants to move. It's natural. It's good for us. It releases all the happy chemicals.
Right.
One of the tools that you use with your patients when you're helping them really overcome this fear and avoidance of specific activity that they believe causes pain for them, is graded motor imagery. So can you explain more about that technique?
Yeah. So graded motor imagery is another word for using your imagination. Mm-hmm. What's really, really cool is that on our brain, in a place called the sensory motor cortex, is an area of a virtual map of our body. So there are hundreds of thousands of neurons or brain cells that have a representation of our tongue, of our mouth, our chest, our pelvic region, feet. Every part of the body is represented on that part of the brain, the sensory motor cortex. So to stimulate the brain to feel that a certain movement is not dangerous is to use your imagination, thinking about you doing that movement or you being in that position that has been a little bit uncomfortable to do because of fear of pain, but that the brain cells using the imaginations get sparked up by doing that thinking, visualization.
Yeah.
That makes sense?
Yeah,
okay,
absolutely.
Cool.
And I'm so excited to show everybody more about this technique because we actually just recorded in the studio this morning some exciting graded motor imagery exercises for pelvic pain that you do with your patients. And it's going to really help scale your knowledge out to everyone who really needs these sort of exercises. So that's very exciting. One of the first things that you do with your patients is you kind of give them this tour of the pelvic anatomy. Why do you do that? Well,
there is a lot of fear if a person is presenting with all kinds of pelvic floor dysfunctions or pelvic pain. There's a lot of fear around this area. Almost it's like a block. People have said to me, I feel like a block from my abdominal region to the pelvic floor region. It's shut off. So I said, well, let's take a tour of these areas to let your body get used to knowing what does it look like and how beautiful is it. So let me show you.
Yes, you've brought your assistant, your pelvis with
Yes, I've got my pelvis with me.
Yes, and this is a female pelvis, but you do this with men all the time as well. You see men all the time as well.
Yes, and I'm going to address that. I think to know that men have pelvises too.
Yes. Very important to know.
Yes, they do. And they also have similar issues at times that come up. You know, our pelvic floor, and I'm going to go, let me do the the tour first.
Please.
So this is the pelvis. Once your muscles have been all removed, this is the front of your pelvis called the pubic bone. These are called the ilium on both sides. They look like angel's wings or butterfly wings. And this is one of the jewels of the pelvis is your sacrum. Your sacrum protects all the nerves that innervate the pelvic floor. So I really love this part of the body. And underneath the sacrum, at the bottom, looks like a little tip of a wizard's hat. This is the coccyx. And these underneath, inside the area is called the pelvic floor muscles. So they basically attach to the front of your pubic bone, and they swing around, attach to the back of the coccyx area, and they also swing around and attach to each side of the ilium. So it's like a diamond shape through here. So it's our diamond. We all have to have diamonds. Mm-hmm. And so with the pelvic floor and the pelvis itself, this ring is like a Super Bowl ring. It supports, it stabilizes, and the floor itself is a beautiful functioning muscle group that allows a couple of things. One is that the pelvic floor helps you stabilize your core. So it works directly with your lower abdominals and your deep spine muscles. So whenever I want to move from sit to stand, my pelvic floor, lower abdominals, and small spinal muscles will co-contract, stabilize me so I can then move on up. The second thing the pelvic floor does, it allows you to keep continent, so you're not leaking anything. Mm-hmm. The third thing it does is that it allows the bladder and the rectal region to release the fluids and release the waste product. So there allows for full release and open and relaxation. And of course, a big part of the pelvic floor is sexual functioning. For men and for women is both. Allow for better orgasm, allow for penetration, allow for erection. So it's a very cool group of muscles working together. The last thing it does, which I have to mention, is that it is a mirror of anxiety and a mirror and we love that, or a mirror of calm. So when you are under anxiety or under stress, what happens immediately, and without you even realizing it or being conscious of it, it's a pelvic floor will tighten up. Mm-hmm. So if you're under constant worry, fear, anxiety, your pelvic floor is probably on a little higher alert. And that can start that whole fight-flight pattern in your nervous system. Mm-hmm. When you are relaxed and calm, the pelvic floor mirrors that. So it's a mirror of our unconscious.
That's so cool. I love that. I actually haven't heard you use that analogy yet. Okay, I'm going to write it down. Okay, I think that's cool. So now we're going to do some of the pre-submitted questions from the community. These are all going to be anonymous. All right, let's go. So first, how is healing chronic pelvic pain different than healing other types of chronic pain?
Outside of talking about the different anatomical places and the function of the area of pain, there is no difference. We really are doing the same thing all the time, but in a different way for each person. Each person comes in with a totally different story, different childhood upbringing, different societal feelings about their body and about situations. It's amazingly individual. So while my goal for pelvic pain, for knee pain, for migraines, for headaches, for shoulder pain we might use a different terminology, the end result is still the same, is to help decrease the overactivity, the hypersensitivity of the nervous system, to calm down the immune system from sending all those pro-inflammatory cytokinins, and to facilitate more of your brain to send those inhibitory, beautiful, happy chemicals, serotonin, dopamine, to your body.
Yeah, and I think it's also important to note that, we say chronic pelvic pain versus chronic pain, but we're really just talking about persistent symptoms here. Like the same thing that applies to chronic pain is going to apply to the chronic experience of not being able to go to the bathroom or leaking or not being able to have sex. Like all of these things, they have to do with the nervous system and with retraining your brain. And it's all a very similar process as to what is going to be able to help you move forward. So,
exactly.
Very cool. Okay. Next question. How necessary is manual manipulation and movement exercises like stretching for pelvic floor dysfunction when you're already also doing mind-body exercises and techniques?
Beautiful. Well, the fact that you're doing mind-body exercises and techniques is half, I hate the word half the battle, but it is half the battle, because you're actively incorporating mindfulness, breath work, visualizations, things that will help improve the breathing ability, the parasympathetic calming nervous system, and bringing peace to your brain and to your nervous system. I find that it's important to do a combination of things. You know, our healing process is not all or none. Surgery or no surgery. Mindful exercises or no mindful exercises. Physical therapy, no physical therapy. It's really your journey to find what heals you the most. Do you love working with a pelvic physical therapist? Do you love working with your acupuncturist? Is there a meditation that really speaks more to you? You find what works best for you, learning that there is the ability that you have to heal. And that's my role, and anybody in the field of health role, is to be a guide, to guide you and support you to find what's your healing pace and process.
And you and I had such a great conversation about this yesterday, about how in healing, there are just no binary outcomes with these sorts of persistent symptoms, right? That people expect that they're going to come into the process and they need to choose just one modality, and that modality needs to heal them or cure them 100%, or it didn't work for them, you know. But the reality is that, you know, different people are going to have different responses. Maybe 20%, 30% of their symptoms are going to get better from this modality, and they have a great supplemental effect from this modality, and those two actually amplify each other. So it's such an individual journey. And it's not this all or nothing approach. It's whatever is working for you. So I love that.
There's definitely no one quick fix, one magic bullet, one procedure, one electrical stimulation thing.
Right.
It's you. It's you learning, how can I heal myself, heal my emotional wounds if I have any, which all do.
Yes.
Psychological wounds, which we all do. How can we learn from this and take these steps? And what's so cool about the new pain neuroscience and the research is that there are lots and lots of proof how movement, how manual therapy, how mind-body exercises is part of retraining those neurons, which grow every 3 to 4 days. Our brain cells grow every 3 to 4 days. So we have opportunities to rewire regularly, no matter how long, till you die. Let's put it this way.
I think that's a good thing to like tell yourself every single morning. Like, my neurons are replenishing today.
Yeah.
Today is a new day for some of my neurons. So let's go. Let's get these guys in motion.
Let's do it. Yeah.
I love that. Okay. What are your tips for dealing with excruciating period pain and or cramps? We get this all the time. A lot of people out there want to know exactly how to handle this issue.
Right. Well, inside your bowl, this is your bowl of your pelvis, you have your beautiful, squishy, soft organs, and they should be squishy and soft and sloppy, move around. They're supported by ligaments on the pelvic ring, the inside pelvic ring. So you have your bladder in the front. For women, you have your uterus right behind, and then you have your descending, your rectum, descending colon in the back. So all these little organs should be able to move. And if there has been history of increased period pain from when you were just starting your period, your body may perceive, even before the period comes, your brain might say, oh, here comes my period. I gotta get my battle stations up. I'm gonna be in so much pain. So your brain has started to learn that period means pain. So I'm gonna tighten up and I'm gonna protect it as much as I can, send pain to let you know it's painful. It's kind of a strange way to put it. So what can you do? One of the best things I would suggest would be, can you place your hands over your lower abdominal region, and can you pick up the skin, can you pick up and roll it? Is that skin over your lower abdominal region, which is over the bladder, over the uterus, over the fallopian tubes, are they mobile? Can you actually move the tissue up and down, side to side, just to see if the skin will tell you? Usually if there's restrictions or sucking down, or if there's been some scar tissue, the skin will not move as well. So the first thing would be, can you move the skin? Second thing is there are techniques called visceral mobilization that a lot of pelvic physical therapists have learned, and they actually are gently, so subtly mobilizing or moving or actually helping to soften the tissues and the organs to see if it moves well. So that's something else that can be done. And then also incorporate that mind-body exercise. So make sure that you're training your brain cells and your nervous system to be accepting of uterine cramps are uncomfortable. And they are to anybody who's go through their periods. But it shouldn't, we don't want it to be to the point where it's excruciating pain for a couple of days every month. That's way over the top. And that incorporates some of that brain neurological, peripheral nervous system involvement.
Mm-hmm.
Yeah.
Wonderful. So next question, what are your thoughts and tools for processing pelvic pain or organ discomfort postpartum?
So postpartum, a lot of women when they are pregnant, which is really an amazing time, and hopefully they have a really wonderful experience of being able to carry the baby and to term. There's a lot of rehabilitation, a lot of things that have been overstretched, muscles, pelvic floor, lumbar spine, postures that they may have taken on. Maybe there's been a natural spreading apart of the rectus abdominis muscle, and instead of it being close together, there has been a spreading apart. Sometimes it doesn't bounce back naturally. So I always highly recommend go see a pelvic physical therapist for at least 1 or 2 visits within 4 or so weeks after giving birth. So we can teach you, and test to see, do you have a little bit of a diastasis recti? How's your pelvic floor coming together? Its function, and maybe you might initially put on a lower back, a corset underneath your pelvis, just as you start for the first 2 or 3 weeks post-surgery or postpartum. So there are additional aids with that. And then know that there is no such thing as it's normal to leak after giving birth. That's not normal. And so I think the new normal is see a pelvic physical therapist and learn some of these easy to implement techniques to keep your pelvis, your lower abdominals, and I'll check your alignment of your posture, making sure you're not in a slouch position for too many weeks.
Mm-hmm. Yeah. Wonderful. So is pelvic pain typically related to issues around sexual trauma, or can it be from any stress?
There's probably a higher percentage of pelvic pain related to some form of sexual inappropriate or sexual abuse. Doesn't mean that everybody that has pelvic pain has had to have had a sexual abuse issue.
Mm-hmm. Yeah.
Clear? That makes sense?
I think that does make sense. So
okay.
Other stresses that are going on in your life could be contributing to that as well. We talked about earlier that it's a mirror, right?
Yes.
Yeah. So any stress.
So any stress, if a person is always nervous, anxious, worried about whatever, emotional connection with a spouse, work pressures, that can add right away to the pelvic floor muscle tightening up because of that reaction that the pelvis has, or the mirror it has to the brain.
Absolutely. Is it common that pelvic pain starts when a person starts trying for kids? And if so, why is this?
Well, it really, there's no correlation with starting to try to have children and an onset of pelvic pain unless there is so much stress and worry and anxiety about, I need to make a child, need to conceive a child immediately. So both partners, male, female, are involved with the sort of stress levels. And when there's an anxiety or worry, there's an immediate flood of cortisol or these pro-inflammatory cytokinins, which is your immune system gets all revved up, starts sending stuff, which doesn't make the environment for conceiving wonderful. So the answer is, as much as possible, approach the conceiving method with a sense of calm. Mm-hmm. Learn what techniques you can do, you and your partner can do to be easy with this process and allow the environment to allow the baby to be conceived.
Mm-hmm. Mm-hmm. So we got sent in several questions about specific diagnoses and people generally asking, here is my diagnosis. Is there help for me? Could mind-body strategies work for me? Would those be helpful for me? So I'm just going to read you off several of the diagnoses we received in that same kind of question format. We have IBS, pudendal neuralgia, interstitial cystitis, neuropathic nerve pain in the urethra, and vaginismus.
So the answer is yes. You know, when you're doing mind-body exercises, it's not just pretend. You're actively stimulating various opioids, which are way higher than any opioid you can take over the counter. You're stimulating oxytocin, which is that calming and social connection hormone that's released. You're also sending your peripheral nervous system is not getting as aggravated. It's a calming effect throughout the whole body. So for all these symptoms, and, you know, not to be negative about you need to have a diagnosis before we know what to do with you. For us in the pelvic world, it really doesn't matter what the diagnosis is. Yes, if there is pudendal neuropathy, yes, there might be more of that burning sensation. But the process of helping you learn what helps you heal the best is really the most important process, is to help you figure out, along with us, what can we do to facilitate your healing, to unravel this whole central sensitization from the brain and from the nervous system.
Mm-hmm, absolutely. Okay, let's see what else we have on here. Just a few more of these pre-submitted ones. I've been told by doctors that my pelvic pain and back pain is attributable to SI instability, postural muscles, and a weak core. Could you speak to these factors?
Oh, yeah. You know, if I took 50 people at random and said, I'm going to check your pelvic levels. So for your people who may or may not know what the SI joint is, so these are your ilium, your pelvic crests, and the ilium connect with the sacrum at the sacroiliac joint. And this is an area of a lot of stress and tension and pain for a large group of people. So what we look for first, as I mentioned, if I took 50 people and I said, let me check the levels of your pelvis. Sometimes with the pelvis, I might find, instead of being them equal to each other, I might find one turned up a little bit higher, the other one pushed down a little bit higher. I might find some rotations. I might find one be up completely, other one lower. These are all imbalances, some a little bit more than the other. So if we do find these imbalances, we'll try to correct them with some muscle recruitment to allow the muscles to feel more comfortable in these movements. But a lot of people are not symmetrical. So if a lot of people are not symmetrical in any part of their body, whether it be if our vertebrae are really stacked one beautifully on top of the other, or if there's a little bit of asymmetries in the pelvic region, the goal with understanding this is that what we want to do is lower the sensitivity of your nervous system and lower and improve the sending of good chemicals to your body by incorporating some easy manual therapy, some gentle movement work, and recruit the core, show you how to strengthen up once we have relaxed the pelvic floor a little bit, show you how to strengthen the whole core and body to be more balanced and to make you feel better. But so the end result is we're trying to have the brain and nervous system be more comfortable with the sacral region and to allow for better flexibility and strength in the area.
Mm-hmm. But you don't have to walk out of the office with perfect balance. And most people aren't going to have that.
That's right.
You don't have to have perfectly balanced pelvis in order to not experience these persistent symptoms anymore.
Exactly.
Okay, good. Wonderful to know. Let's see. Okay. What are some helpful mind-body practices to help convince your subconscious that your pain is not structural when it comes to tailbone and sitting pain?
Okay. So read that again.
What are some helpful mind-body practices to help convince your subconscious that your pain is not structural when it comes to tailbone and sitting pain?
Okay. Well, I'm going to show you where the coccyx is. So just here is the sacrum, the bottom of the sacrum, and this is a teeny tiny coccyx. bone, basically the tailbone. And as you can see, these are the pink muscles, the pelvic floor muscles that physically attach onto the coccyx. And so there's a little bit of movement that happens with the coccyx. It goes slightly in, like a little doggy's tail moving inward. And when you have to go to the bathroom, poop that is, the tailbone slightly moves out, so allows the pelvic floor to also open. So structurally, we're talking that if there is anxiety, fear, worry, the pelvic floor will tighten up physically and will also then pull on the coccyx. So by doing some of these mind-body exercises and doing some of the breath work, you are actively sending signals to the pelvic floor, which attaches to the coccyx, that you're safe, that the area is soft, open, and receptive, and that will help decrease the anger of irritation around this particular region.
Last pre-submitted question, and then I'll go check and see what our team has submitted to me from the Facebook feed. When we're talking about bowel movements, what are some tips and strategies that you have for folks who have been unable to achieve one for several days? Very uncomfortable situation to be in. Why does this happen, and what are some tips to get through it?
Right. Constipation is a very, very big part of my practice. And what I tend to find, as I just mentioned about the coccyx, so I'm going to go back to this is the anal region, and the muscles attaching onto the coccyx are these pelvic floor muscles. So the connection with tension in the pelvic floor, if there's constant tension, without you aware of it, you might be holding your pelvic floor in a tight state, again, from fear, catastrophization, worry, anxiety. That will therefore naturally pull the pelvic floor tighter, not allow the pelvic floor to open and release when you need to void. And what happens is that people a lot of times will be getting a little bit overzealous in their going to the bathroom, and they'll spend way longer than 5 minutes straining and pushing. If many, many years of straining and pushing, you actually create almost like a little ballooning effect of the rectum. So the waste products get sort of collected into that area as well. So one of the sort of tips that I do, along with doing some mind body exercise, is number one. 2 is doing some breathing exercises, which we have here in one of our podcasts or one of our exercises, breathing techniques to help open the pelvic floor, positive affirmations to visualize that your waist is able to move out effortlessly and easily. Is this very simple technique that I'll have people do while they're voiding. This is when they've had almost too many years of straining, is as they go to the bathroom. I'm showing you the front of the body. They place their hands just behind, this is for women, just behind their vaginal opening, and for men, just underneath the scrotum, in this thickened tissue called the perineal body. And they actually press up and in, forming like a little barrier, not allowing the area to balloon, and then they bear down. And so it's very effective.
Yeah.
Along with your classic, you've all heard of the squatty potty, or something where you place your knees up higher than your hips as if you're squatting. So those are really fast and very effective techniques for that.
Great to know. So now we're going to go to some of the questions that are being submitted by folks who are watching the feed live. Let's see. So I think that this one might need to be a bit more specific, but I'll just get your general response to it. The question is, so is this stuff structural at all, or is it all just the fear response? Aren't there growths in cells that don't belong there creating pain?
Aren't there growths in cells?
Growths and cells.
Okay.
So I think this is going to be super dependent upon what condition we're talking about, and because, you know, as we know with endometriosis, there's scar tissue, there are things that are there that you
barriers
can see, and yet there are strategies that you and I have discussed about pain management in relation to that as well. So what are your thoughts on structural tissue damage versus fear response, I guess?
Right. So I find that it's not just only doing mind-body exercises that is going to be the trick to unravel a year's or 2 months worth or 17 years worth of habits. So what I find important to do is to move the tissues. How can we improve mobility, allow better blood flow? If there are scar tissues, can we soften, teach you what you can do to soften these adhesions, and to do some stretches to allow that area to have more mobility. So there is a combination of the manual therapy, which helps to reduce the tension of the pelvic floor via the brain and the nervous system. So it's a combination of that along with exercise, along with your mind-body exercise as well. Physical exercise, I should say, along with mind-body exercise.
Right. Like movement and exercise, always a great thing for the body.
Yes.
And, you know, just thinking about all of these different conditions, oh gosh, I forgot what I was going to say.
Well, one thing I have to say about movement and manual therapy, you know, a lot of people have said, well, you know, the last time I had manual therapy, it really flared me up. And that's a valid point. So the manual therapy I'm talking about is super, super gentle. It's also done with you being actively involved with it. How does this feel? Do you sense any sense of tissue stretching or any sense of movement in this area? Can you breathe into my hand? So we're using your input along with the therapist guided hands placement, and just our touch can stimulate the oxytocin in your hormone, in your brain to say, yes, I have a societal touch. It's calming and it's healing. And that right away floods your body with happy chemicals. Mm-hmm. So, the manual therapy as well as the exercise is based upon how do you feel about it? Do you think it's really safe? Will it cause more tissue damage? And there are lots of other guidelines we use for exercise. I just want to make that comment about. Mm-hmm. It's not like just get in there and like, you know, work it out and everything is fine. No, it has to be with you as part of it.
Right. Yeah. And I now remember what I was going to say.
Okay.
So it's all about habits too, right? Like your body has been trained to be in this habit of clenching for 17, 25, however many years.
Yeah.
So while it might have gotten there through anxiety and stress and all of these different reasons that are very important to unwind, mm-hmm. it couldn't hurt to actually physically do some retraining of that muscles and proving to your body that gentle movement and whatnot is safe again. So exactly. I think that that's really where these two things go hand in hand and complement each other very, very well.
Exactly.
Yeah. Okay. So another question that we've got, could you speak to the longer term outlook? Are all of these conditions likely to be healed or just managed? What do you see in your practice?
That's a great question. It's your healing journey. It's not mine. But I am going to show you and guide you on a lot of the wonderful tools, along with Curable's amazing mind-body exercises to help you find your path. Some might get that right away. Others might take a longer period of time. But the process is what you want to focus on. I am healing every day. I can help myself get better. I have a good team that supports me. I have family who loves me, that want me to get better. So there's a fine line with that. I have seen a lot of people make some beautiful changes in my professional career over the 22 years in practice. So I could say, yes, there is an ability for a person to regain function without as much pain. I'll have to mention about feeling little body discomfort versus sharp pain. You know, if you ask, again, like 50 people, do you ever have any discomfort or pain in your body? A lot of people say, you know what, yeah, at times my upper back's a little stiff. I feel like in my neck. Sometimes I wake up with a crick in my neck, or yeah, I feel some lower back or knee pain, but it's very, very low level. It doesn't really stimulate the brain to say, oh no, she or he is in danger. Let me send slamming more pain signals to make sure she protects herself. So, you know, it's a fine line. Well, how does one describe pain? And managing pain or healing pain. My interest is to help you learn how to heal yourself. So it's not just about managing anymore, mm-hmm. especially when you're dealing with the mind body. No, it's not managing. It's really healing.
Yep. I think that's a great response. So how important is it for people to get a diagnosis before proceeding with some of these strategies?
You know, we're very biomedically based. There's nothing wrong with that. But if we only are staying biomedically based, what's the tissue that's at stake here? Then that becomes to be a problem, as unfortunately most of you may have experienced having something for over, way over 3 months worth of it. So having a diagnosis, if it gives you peace of mind that there's a name for something, if that helps you feel calm, then awesome, then use that. Nothing wrong with that. The challenge is when people are saying, well, it's not really this, and I need to find this I need to find the tissue, the vein, the particular nerve that is causing my problem, and you're doing this over and over again, then that's not really looking at the whole biopsychosocial aspect of what's going on with you.
Mm-hmm.
Does that make sense?
Yeah, I think that's so don't pin your whole journey on getting a perfect diagnosis. What I always tell people is, rule out the things that are extremely dangerous. Rule out things that are life-threatening. Right. And then beyond that, what we find with a lot of people who come to Curable is they've gotten a lot of conflicting diagnoses. And this has created a ton of confusion and anxiety for them. And it's really just done more harm than good, because as we know, the confusion and the anxiety, goes straight to the pelvic floor.
Absolutely.
And so, I think that once you've gotten an opinion or two from well-educated, well-informed, well-intentioned doctors, it's time to start saying, okay, well, I need to stop waiting for a specific diagnosis, a specific doctor to come in and save me, and start seeing what steps can I take to, do what I can in this healing process and in this healing journey. This is another sort of similar question to what we've been getting. A lot of folks have read books from Dr. Sarno, and the Sarno school tells folks not to focus on the physical. What do you think is the best level of focus on the physical?
Well, there's been an evolvement, a natural evolvement from when Dr. Sarno started doing his work, which was very valid at that time, but it was very dogmatic. Don't do anything else. Don't do any manual therapy. Don't even bother to do exercise. It's just the mind. But the research shows it's not. And the research is showing that manual therapy can lower the amount of pro-inflammatory cytokinins. Manual therapy can increase the level of opioids and oxytocin release. Manual therapy feels good for a lot of people. So these are all good things towards incorporating a little bit of a wider plate of things that will help you.
Right. And just like you mentioned before, it's not manual therapy in the sense that we viewed manual therapy back in the time of Dr. Sarno. Back when Dr. Sarno was writing his work, manual therapy was viewed as this way to stretch your muscles in a certain way and correct your joint. And that's just not how you're using it in your practice at all. What you're doing is creating this therapeutic alliance, making people feel safe and comfortable so that all of these good, happy, safe chemicals are releasing in their body, using the power of touch, the placebo effect even. It's a good cultivating thing. It within them. Yes. Anything that activates the placebo effect and is safe.
Yes.
I'm in. I think that's great. Yeah. The placebo effect is very underrated. But so that is a great question. Okay, next one. I have interstitial cystitis and endometriosis as well as a herniated disc. My osteopath told me that the pelvis is blocked and that the I'm going to mispronounce this. You know what I'm talking about though. Yeah. Sacroiliac joint.
Sacroiliac joint.
Yes, was also blocked. Ooh. All of those conditions are in the pelvis. How could they be related, and how could you treat them? And just to recap, since that's a long question, we're talking about interstitial cystitis, endometriosis, a herniated disc, and that the pelvis is blocked, and that the SI joint is also blocked.
Okay. If you took 50 people and said, without pain, any major pain, and say, you know what, I want to MRI your lower back. Let's see what's in there. You would find amazing amounts of herniated discs, spinal stenosis, spondylolisthesis, SI joint adhesions, lots of stuff, but they're not in pain. So that's why we're moving away from the biomedical diagnosis, because research is showing that that's not always going to be the cause of your symptoms. So herniated discs and MRIs, we're learning that only 3% of people with back pain really need an MRI and need surgery. That's 3%. What happened to the other 97%? What's going on there? It's not a herniated disc. It's the chemical. It's the chemical imbalance within your immune system. It's the heightened level of peripheral nervous system input into the spinal cord. It's the brain getting constant danger signals, overactive, almost like a helicopter parent, and slamming all kinds of pain signals to the body to help you protect yourself. It's got a little bit off kilter. So, I don't know about, she had endometriosis as well. Mm-hmm. I don't know if we haven't done any studies where we're going to look at, scan all abdominal regions and look for endometrial tissues in the body of 50 females. Would we find some in females that are not having any pain? So I don't know, and I don't mean to cause any discomfort or stir with that. So the bottom line is, what I've learned is, again, it's how can we reverse that pattern of anxiety and fear, and let's not do movement now, or oh, here comes my period, I'm going to have pain. Oh no, I have to go to the bathroom for the 50th time, for the 15th time today. I'm not sure if I'm releasing it all, and maybe it's those Hunter's ulcers inside my bladder that's not allowing it. I mean, so yes, there are physical symptoms that you can definitely see. So let's do some of those calming mind-body exercises and movement and manual therapy combinations to see if we can flood the body with calm and lower those symptoms that you might be feeling.
Okay.
Yeah.
Great. What do you think about vulvodynia that manifests on the vulvar skin?
So vulvodynia means pain on the vulva of the vagina. So the outer skin of the labia, which is right through here, is usually the area of irritation. So one of the things I'll ask people to do if they have pain on the outside of the labia, on the inside of the labia, is I'll do a Q-tip test, if a doctor has not already done that, to see if there are sensitivities on the whole vaginal opening. So from the lower portion as well as the upper portion, if there's sensitivity there. Two things I have to say about vulvar pain is, first, make sure you see a sexual medicine doctor. These doctors are able to really, they're ahead of their game in terms of really knowledgeable about sexual health in the female. And sometimes vulvar pain is due to some hormone imbalance. So they'll test your hormones. Sometimes the vulvodynia pain is due to a small overgrowth of nerve tissue that comes to the surface of the vulvar skin. If that's the situation, the doctor would certainly be helpful with that. But if it's not those two things, if your hormones are sort of balanced, and there's no neuroproliferation or increased nerve tissue that's irritating the vulvar skin, a lot of it is the oversensitive central nervous system and the peripheral nervous system that is heightened, that is sending you those pain signals, that is making the area irritated and sensitive.
Mm-hmm. Here's an interesting question.
Yeah.
So if sex causes you pain later on, a few hours afterwards,
mm-hmm.
Is it more helpful or harmful? And a note from this person is, I worry if I stop having sex and avoid it, then I'm adding to the problem.
That's a great question.
Yeah.
Here's the thing about painful sex. It's so normal to withdraw from that encounter if you have pain. But if you're in a relationship, right, mm-hmm. that's one of the levels of intimacy. So how can you overcome this? while you're in the process of doing mind-body exercise, going to pelvic physical therapist, learning how to use dilators just to soften and open the skin, doing some positive affirmations. My vagina is soft and open. I'm able to have pleasurable sex. So in the meantime, while you're doing this work, I would certainly start thinking about, I would look into something called sensate focus. A lot of sex therapists are utilizing this technique. And I also write a little bit on that in my blog and my website. And what that is that you don't want to stop being intimate with your partner. So how can you be intimate with him and yet avoid the sex? Well, the sensate focus guides a little bit on how to do that. So one small step would be you'll ask your partner that I'd love to have some physical closeness with you without ending in orgasm or penetrative sex. So you set aside 15, 20, half an hour, doors closed, no children, lights on. So you're actually seeing, you're using your senses, the sense of smell of a person's body, the sense of sight, and you're watching the person, or your eyes are closed and your partner might be doing some gentle stroking techniques, which is very calming. It releases and relaxes the body when there's a gentle stroking technique on the palms of the hand, along the shoulders, along the back, and avoiding the vagina region, basically. So your partner and you can still have the sense of intimacy without having the end result of penetrative sex. So it's a process.
Mm-hmm. One of the questions that just came in, is it true that Evelyn has a meditation for the pelvic area? Evelyn has a lot of great meditations, visualizations, graded motor imagery, exercises for the pelvic area that we actually just finished recording. So very excited.
Yeah,
Stay tuned for that. Mm-hmm. So we've got a couple of other questions and we're running low on time, but I want to go a few minutes over since we did get started a little bit late. What's a technique I can use to relieve bladder pain?
Bladder pain. Again, with what we've just said about using some of the mind-body exercise, because the bladder pain is a neurological end result of again, anxiety or fear or history of having some bladder issues. You know, sometimes people have bladder pain because they may have had a couple of years worth of urinary tract infections. And the urinary tract infections right away zooms up the sensitivity, increases that immune system to start sending those inflammatory cytokinins and the cortisol into the area. So it's a natural reaction after having chronic urinary tract infections or maybe even yeast infections to create that area, to have that area become a little more sensitive. So to decrease that sensitivity would be to do some of those mind-body exercises, some breathing work with the pelvic floor, softening and opening, saying things like, my bladder is able to release easily and with comfort. And a really cool little technique, sometimes people with bladder pain are not able to fully urinate comfortably, or they feel like they have leftover urination because their pelvic floor hasn't stretched out enough to allow for the urethra, the little hose, to empty out. So one wonderful technique that I teach patients is your sacrum is, again, the back. You have S2, 3, and 4 is where the little holes are to allow the S2, 3, and 4 nerves to come out that form the pudendal nerve. And so a lovely technique to do is after you've gone first, you sat and you had your pee, wait for another moment, and then do a very gentle tickling effect over the sacrum and out towards the buttocks. Very, very light touching. That right away allows the nerves, because these are the parasympathetic nerves, parasympathetic P for pore, so parasympathetic pores. So when you do this little light sensate of the area, that allows the pelvic floor to open more and the nervous system to allow things to flow out more. So that might be helpful while you're in the process of doing your mind-body exercise and any manual therapy movement work.
Great. We have another question here. What can I do about rectal pain that's worsened with movement and walking?
So a great thing would be to pace and figure out how much walking do I do before I start feeling a little sensitivity? Or do I visualize, do I think that walking is an unsafe thing and maybe it's okay for the first 5, but it ain't good for the next 5. So instead of me pushing that next 5, I should be able to walk 10 minutes. What's wrong with me? You don't do that. You walk for your 5 minutes and then you say, let me do some calming breathing techniques to tell my pelvic floor, because the pelvic floor is what usually is pulling that coccyx forward, or tensing the pelvic, or tensing the anal region. What can I do to soften and send opening energy to the rectal region? Sometimes doing a stretch like a happy baby pose. You can always Google or YouTube a happy baby pose. It's a great stretch for the inner thighs and the pelvic floor region, or getting into a child's pose position and do some deep breathing and visualize the anal area opening, and then see if you can walk for another 5 minutes. So I find that it's important to be detailed about pacing yourself versus I'm only going to stop at the 5 minutes and never walk any further, because after that I'm done. So, that's not healthy. I mean, who can only walk for 5 minutes? So it's working with either with your therapist, or if you can't by yourself, tracking what you can do, taking a moment when that 5 minutes is up, doing some calming, and then try and go a little further, and track it every day, see what you can do.
Yeah. I think we're getting close to the end of our time, but I want to wrap up just by, having a note about everyone who's struggling with these sort of conditions. It can feel extremely isolating. And that's what I hear when people write into Curable and post in the community. They're ashamed, they're embarrassed, they don't want to talk about it, even with their closest friends or family members. And it's something they believe they are alone in, because when you go to a cocktail party or a family gathering, you hear people saying, oh, my migraines, oh, my back pain, but no one's talking about their issues going to the bathroom, or their private parts are hurting, or they're having trouble being intimate with their partner. And so, I just want to say that it's okay to talk about these things. It's okay to talk about them like adults. If you feel comfortable confiding in someone that you trust, and you should absolutely feel free to talk about it with your practitioners, talk about it in the Curable community, find support from other people who are experiencing this too, because it's absolutely a very common experience, much more common than you realize. It's not something that should make you feel isolated in any way. We're all humans. We all perform these activities, and sometimes the body just makes things a little bit more difficult, and we require a little bit of retraining, and there's nothing wrong with that.
Right. And the field of pelvic health has really exploded, and the research in the area is wonderful to see. Lots of things that you can do to heal yourself, along with seeing a professional like a pelvic physical therapist who really has, in my experience, a really thorough global knowledge about the pain neuroscience, about the pelvic function, about the pudendal nerve, about ways you can do to retrain your brain and calm that nervous system. There's so many wonderful things now at our doorstep, at our fingertips. So I wish you the best on your healing process, and know you can do it.
Well, thank you so much for joining us here today.
Thank you.
For coming out to Chicago to record all of the stuff we have coming up. Everyone stay tuned for more from Evelyn. We recorded a podcast interview yesterday that will be out in a couple of weeks' time. So thank all of you for listening and for being here today, and for your wonderful, thoughtful questions.
Thank you.